Hello, and welcome to another edition of the Cap Times video Q&As. I'm Julia Shumway. I cover the state senate for the Arizona Capitol Times, and I'm joined today by Kelli Donley Williams, a suicide prevention specialist for the Arizona Healthcare Cost Containment System. So, Kelli, can we start off? What exactly do you do as a suicide prevention specialist?
Sure. My role at Access is to make sure that individuals in Arizona have the ability to connect with resources related to suicide prevention and ideally create a state plan that is implemented that reduces our rate of suicide every year. We have a small team at Access. We have 4 of us now working on suicide prevention, and we go through the data to identify priority populations, make sure those communities have access again to prevention resources and know how to access crisis services if necessary, et cetera.
And we've seen, covering the state legislature here over the past couple of years, we've seen kind of an increase in attention being paid to mental health and particularly to suicide. A number of bills that have passed in just the past couple of years, specifically addressing teens and helping parents and teens recognize mental health and trying to erase some of the stigma around it. What has changed in our state or in societies at large to bring more attention to this?
Well, there are a couple things at play. There is some new research out of the CDC to show that there has been a 35% increase in suicides nationally since 1999. So I think just about every family in America has been touched by this issue in some way, and it is more of a point of conversation. But more practically, locally, what we see are community groups coming together and advocating with their local legislator to have legislation passed related to this issue. That's what happened with the Mitch Warnock Act, which goes into effect this fall, and also with Jake's Law.
Great. So the Mitch Warnock Act, can you give us a little background on what that bill does and who Mitch Warnock was, why we have legislation named for him?
Sure. Mitch was a young man who attended high school in the East Valley, and he died by suicide several years ago. And his mother is a high school teacher in that same school district, and brought together several other moms in that community and other advocates in that community to try to bring new resources to schools. And as a result, the Mitch Warnock Act was passed. It is to be implemented this fall of 2020. And what it requires is all school staff who work with children between 6th and 12th grades receive an evidence-based suicide prevention training once every 3 years. And that's really a remarkable change for our state because we've never had a training requirement like that before. And it's not specifically just for teachers. We're talking about bus drivers and cafeteria workers and librarians, the full school. So we're hoping that as a result of this, that schools are a healthier place for behavioral health and also just in general, that classrooms are a better environment for learning, and that people really have the tools they need to be able to identify when someone might be going through a behavioral health crisis, and they know what next steps to take to link those people, whether they're the students in their classroom or a colleague or someone else in their community, to resources in our community to help that person get into care.
So what do some of those resources look like?
Sure. So if you have someone in your home who you've identified or someone in your life who you're worried about for suicide, we always recommend beginning with the crisis line. If you have someone who's told you that they are thinking about suicide, the most important thing to remember is to never leave that person alone until you can hand them off to another behavioral health worker, ideally. And so what we recommend is if you have, let's say you have someone in your home who has expressed suicidal thinking, to call your crisis line and to talk through what's going on. And they will be able to assess if a mobile unit needs to come out, if you need to put that person in your car and go to a behavioral health hospital or an emergency room, et cetera. The physical resources look a little differently depending on where you live in Arizona, but the the online resources related to suicide prevention trainings are available to anyone.
And the Mitch Warnock Act is being implemented in a school year that doesn't really look like any other school years we've seen. A lot of schools are still doing classes either through Zoom or in these hybrid models. Has that presented obstacles in either training teachers or in making sure that these teachers and school workers are able to see what's happening with kids?
So of course it has, so they're both. There has been some obstacles because many of these suicide prevention trainings are traditionally given in person in a classroom setting. And of course, those are on hold for the time being. But on the flip side, what we're actually hearing from teachers and school staff statewide is that they were very worried about the anxiety and depression levels among children in the classroom when they return, whenever that return was scheduled to come this fall. And so they took the time to take their training online over the summer. And we have seen a significant number of individuals who've taken trainings through our partnering agency, the Arizona Department of Education, because they offer online vouchers and they're able to actually watch those numbers. So I think more people are getting trained right now than ever before. And I think a lot of school staff use this summertime and even the time before when schools unexpectedly closed during the pandemic to get this training. So they're ready to go this fall.
And what does funding look like? Do we have funding for these teachers and these school staff to be able to get their training? Do we have other state funding or federal funding allocated to preventing suicide?
The short answer is no. The legislation did not come with funding to be able to pay for these trainings, but Access was really strategic in the 8 trainings we selected that are eligible to meet the requirements of this law to make sure that at least one is free. Several are available online, and right now through different grant opportunities through the Department of Education, one of those trainings also is available online for free through a voucher system. They were able to purchase 10,000 vouchers with some grant dollars. Otherwise, there are federal grants that come into play, but not necessarily related to the Mitch Warnock Act. Suicide prevention has not traditionally been well funded through the state legislature or through the federal government in Arizona. So we did just receive a large federal grant, our first with our Access team related to suicide prevention, which was really exciting. But it is not specific to the classroom. It's specific to Pima County, where we did have an increase in suicides once the pandemic began, and it pairs services, suicide prevention services, along with domestic violence services for adults in that community.
And are there specific demographics or groups that are most at risk for suicide?
There are. In Arizona and also nationally, the largest group of individuals who die by suicide are 65 and older white men, typically by gun. Firearms are the most common mechanism for dying by suicide in Arizona and nationally. We worry about our folks, especially our veterans and those who live by themselves. Isolation is a risk. And surprisingly, even though it's something like 60% of the population in Arizona lives in Maricopa and Pima counties, we see the majority of our suicide deaths in rural counties. So this year, for the first time, Gila County actually had the highest rate, but several of our rural counties had the largest percentage of suicides. So we really ask folks, if you know of someone who lives alone and is older, to check on them regularly and to ask them about their mental health and to have your crisis line saved in your cell phone. So if for whatever reason you feel like you need to call and get some advice, you know right where to go. Of course, other populations are also at risk for suicide. We know our American Indian communities are at heightened risk as well. It is the second leading cause of death for American Indian children in Arizona. And our team works closely with tribal governments and tribal partners statewide. But we have seen a noted increase in suicides among all age groups in the last few years. And we have about 1,400 Arizonans who die by this issue each year, which is just a tragedy for each of those families. And we will not stop doing this work until that number is 0.
Is there any, beyond the bills that have passed in the last couple of years, is there anything more that Access or you might be working on with lawmakers, anything that can be done at a policy level to help this?
We're not working on anything with any policymakers at the moment. We're honestly so busy in the day-to-day work in the community trying to get trainings into the right hands of folks and talking about the warning signs and working with schools to create relationships with behavioral health providers so they have someone right on campus if they identify somebody who's at risk. Our team is not working on legislation, but what I would say is we are so thankful that suicide prevention has garnered the attention it has for the last few years at the state capitol, and we welcome these conversations with anybody who wants to talk about the issue. It's important to see the great strides we're getting in funding of behavioral health in schools and seeing more partnerships. We had something like 16,000 kids who are enrolled in Medicaid, our state access program, receiving services on a school campus in March when schools closed. And that's, some people say, gosh, can you believe there's 16,000 children who needed that service? And in suicide prevention, what we say is, thank goodness they're getting those services, because those services in place will hopefully help them prevent a behavioral health crisis further down the road.
And what, if people watching this, people who read our newspaper, what should they know if they want to make sure that their loved ones, their friends, neighbors are safe from this?
Sure. So watch for isolation, watch for someone who's pulling back from normal daily activities, or individuals who live alone are particularly vulnerable to suicide and suicidal thinking. And if you have someone in your home who you're worried about who may be experiencing suicidal thinking, or maybe dealing with severe depression or other behavioral health concerns, it really is a smart time to remove some things from your home. So we recommend that if you have firearms in your home, that for a period of time you remove those. If you don't feel comfortable with that, to remove the ammunition, of course, to make sure that any firearm in the home is always secure and safely locked. To remove alcohol for the time being. There are many deaths in Arizona. The majority of suicide deaths in Arizona involve alcohol. The person has alcohol in their system at the time of death. It's a depressant. Get it out of the house for the period of time until that person starts hopefully feeling better. Again, prescription medications or over-the-counter medications that you may not need, get those out of the home, take them to a prescription drop box, and really try to encourage that person or physically take that person to a behavioral health provider and get them into care. The more conversations we have about suicide prevention and behavioral health care, we reduce the stigma every day associated with this. And there should really be no downside to saying, I need some help, I need to talk to someone. Having that conversation can save a life.
And if the person watching this has experienced any of those suicidal ideations themselves, where should they go to find help?
So we recommend that you call the crisis line. We have crisis lines across the state. Call the crisis line and get some advice on what next steps look like that are appropriate for your community. If you don't feel comfortable doing that, please feel free to go to an emergency room. If you're feeling actively suicidal, that is completely appropriate. We'd also recommend that if you're a veteran, to connect with Be Connected. Be Connected is a statewide campaign to specifically prevent suicides among individuals who've served in the military and their family members, and they have other resources as well. That website is beconnectedaz.org, and you can call 211. You can connect with resilientarizona.org. We have a lot of resources out there right now for folks who may be dealing with behavioral health crises or depression or suicidal thinking. And if you are dealing with suicidal thoughts yourself, what I would just say is you are important. Your life matters. You may not feel like you're connected to someone right now in your community, but I promise you that your life matters to us, and we want to help you get the care you need.
Great. Thank you so much. Again, that was Kelli Donley Williams, Suicide Prevention Specialist with Access. And we will be back next week with another Q&A with someone in the Capital community. Thank you for watching.